what's the big three? Why should they be treated together? And how do we treat them effectively coming up next? So there's a group of muscles that I call the big three, and I almost always treat them in the same session. These muscles are Pec Major, Pec Minor. I include that all in the pecs, so that's one, pecs. And then Latissimus and Teres Major. Those three muscles are essential to have some good practices to release them if you want to help people with shoulder issues, neck issues, headaches, all the upper body stuff. Pec Major and Pec Minor both contribute to this rounding of the shoulders. Well, so actually does Latissimus and Teres Major. You see, Pec Major comes up along like this beautiful fan along the side of the chest, each side of the chest, attaches along this collarbone, has a strong pull on that collarbone, and attaches into the arm right here in what's called the bicipital groove. Well, Latissimus and Teres Major, Latissimus, big, huge back muscle, right? Comes up, comes along, becomes the back flap of the armpit, comes across and attaches into the bicipital groove. Latissimus, from the low back and the side, comes up and attaches in the bicipital groove. And so does Teres Major. So we have Pec Major, lats, and Teres Major. Pecs are the front flap of the armpit. Lats and teres are the back flap of the armpit, and they come and all attach right here on the arm. Because what do these muscles do? They pull the arm down and internal rotation. Well, you can't be up tall and internally rotate your arms at the same time. Like, that doesn't work, right? So what happens is this. There's a sort of slouching that goes with it. So anyone that you're treating with rounded shoulders, slouching issues, headaches, necks, you know, right? Because if you look at this, this is not a happy neck right here. This is a jammed up shoulder and a jammed up neck. So by treating pecs and lats and teres, which you're going to learn very specific trigger point work later in this video, but I really want to lay this good foundation because it's so key. You will find that about 80% of the time is about my running tally. When someone comes into me with shoulder issues, loss of range of motion, all the things, they're having loss of range of motion, weakness, aching in the shoulder, pain in the shoulder with movement, they are about 80% better just after I release pecs, lats, and teres. Like 80% improved from releasing pecs, lats, and teres. I didn't even touch their shoulder muscles. I didn't touch any of their rotator cuff yet. I didn't touch any trapezius yet. But that alone, because you see, the key to this work that I'm teaching is go to what's short, release that first. In the case of rounded shoulders, what's short is pecs, lats, and teres to begin with. Open that up, the shoulders can go back, the neck can go back. You see, because when the shoulders round forward, the humerus, like this shoulder joint, is the most freely movable joint in the body, except when it isn't, right? So it's just a ball with a little socket. And I'm going to do a whole thing about the shoulder girdle, understanding the anatomy of the shoulder girdle. But just know that when that ball ends up being forced out of center of the socket, it's going to automatically activate the rotator cuff. So you want to release what's pulling it out of center in the first place. And out of center, the muscles that pull it out of center, the biggest muscles that do that are pecs, lats, and teres. So I'm throwing in here a little quick Pec Minor because Pec Minor also draws the shoulder forward, and it's one of the pecs. But Pec Major, lats, and teres all attach right here in that bicipital groove. Pull the arm forward, pull the shoulders rounded forward, and wreak havoc on the upper body. So we're going to begin the treatment section with Pec Major. I'm going to show you both sides treating. We're going to go into Pec Minor, and then the client will turn over and we'll do lats and teres. See you there. I got my hands on both sides of those pecs. I can just start kind of squeezing a little bit, walking up and down either side of the pecs, kind of feeling, where do I feel restriction? Where do I feel things are a little jumbly? And then there are several areas where the pecs tend to gather some tension. And those are often on the side, the very outer edges of pecs. Those are going to be real fiery, kind of even stingy points. And then there's some along, a little bit out from the sternum on either side. And then right in what I call the shoulder valley, this space in between the ribs and the head of the humerus and the top of the arm bone. So we're going to do some nice soothing and warming up so we can get these pecs a little bit prepared. You know, this thin tissue, you don't need to work real deeply in the pecs because they're not deep muscles. So you don't need to work as hard as you can or press as hard as you can into the pecs because you'll be trapping them easily against the rib cage. So we want to do some nice, I'm just kind of getting them ready for some work. And all of my soothing work is also a little bit of palpation. You know, I can strum across the ribs with my knuckles. And I'm just using this part of my knuckles here. Just a soft fist. And then if I drag my thumb behind it, I can start to feel on either side where some of those trigger points and some of that tension is gathering in her body. And because we do use oil in the FreeBody method, some trigger point folks don't use oil. But I feel like you're really missing the boat on some of the best part of massage work if you're not using oil. But then if you put too much on, it might get a little slippery. Just take a towel, keep a clean towel nearby, or a pillowcase. You can just wipe some of that off if needed. Depends on how dry their skin is and how much their skin is absorbing. So now we're going to work through Pec Major, and also we're going to add in subclavius because that's a really key spot right here. So Pec Major, I'm just going to come right to the side. You can stand or sit for this work. And I'm going to ask you to take your hand out here. I'm going to set that right there. And then now I want to find that edge of Pec Major. We want to get right into that side so we can kind of lift those pecs up. And then I start putting my fingers again underneath Pec Major, sliding the thumb across, and looking for just those edge points. These spots, again, tend to be kind of fiery. So we want to sink slowly as we squeeze. And you'll notice I use my other hand to help gather the tissue, and that just makes it a lot easier for me to grab. So my other hand helps to draw the tissue, anchor it there, and then I'm going to squeeze between my thumb and my fingers to get in, and then I'm going to ask my client, is that a tender spot right there? And how does that pressure feel? Does it feel right? Not too much and not too little? Okay. And then we just encourage them to take some breaths. And then let's really bring the breath down low in the body. Bring the breath down into the belly. Yeah, beautiful. And then will you let me know when that starts to feel a little easier? A little bit. Feels like it's starting to release right there, actually.
Yeah, it's not as tight.
Not as tight, not quite as tender, yeah. So there's often two spots, one down low, about as far down as you can still be able to grab and lift the tissue off. And then one higher up toward the armpit. And you just, so here I am in skin, that's not the muscle. So I have to get underneath that pec so that I can actually be grabbing the pec major itself. And then this one, ooh, that's gonna be good. How's that feel? It's tender spot there, right? So for this one, we're gonna let her just take a couple breaths down low in the belly, let the belly get really expansive, softening the whole nervous system. Remember that belly breathing just begins to relieve tension through the whole body. I find the pecs respond very well to some movement. So you just ask your client to bring their arm out at and keep a 90-degree angle at the elbow, and they're going to wave their hand, and it's going to move that shoulder through internal and external rotation, and it's going to engage and stretch the pecs alternately. So I'm going to find that little spot again. And it's always just right up there, right in that corner. There's almost always a very tender little spot. Yeah, did I find it again? Yeah.
A little further down, I think.
A little further down.
There.
Great, thank you for that feedback. And then she's gonna just start moving her arm, keeping the 90-degree bend at the elbow. Yep, it doesn't have to be that far, just enough to, now as she opens it back, it's gonna get way more exciting in her trigger point. And then she just kind of moves it till it's exciting and then backs off, moves the hand a little bit forward. That's plenty. And then back to behind her, and she wants to just keep that movement going. It's more about the movement and keeping that movement going, because that's what is going to keep the muscle engaging and softening and engaging and softening. Feel like I'm slipping a little bit off that spot. Get back on it. See how I use my hand again, my other hand, to kind of feed that tissue in there. There it is. And then let it get a little faster now. So we go back and forward, and back. And you, as the therapist, you're kind of along for the ride here, because it's a little bit of a roller coaster. And as they move, the tissue is going to want to kind of bump you out. Okay, and how's that feeling? Does that feel like it's softened? Less intense yet? Yeah, okay, great. You can relax your arm back down, yeah. And then we want to do soothing. Right.
You made me work a little bit.
You did. And that little bit of participation is especially helpful for people who, you know, have trouble like letting go all the way. But it's also that engagement and shifting of the tissue makes a big difference. It helps that tension go back into tone in the tissue. Okay. And so we've addressed these two outer trigger points in the pec major. We could do it with movement or not. And then sometimes I like to just sink right into that valley. There's often, because this thick clavicular head of pec major, it's thick, it tends to get really bundly. And so I like to just get about halfway down this little valley, this line, and sink in. And I'm going to stand up for this. And I'm going to use a supported thumb. And I'm just going to sink straight down and pin against her ribs. You let me know if there's anything exciting in there, Miss Tifa.
It's very nice. It is tender.
But
it feels really good.
Feels good, right? Yeah, it feels really good to have it pressed on. And then Tifa, I'm going to let you choose. Do you want to do that movement? Opening the arm back. Yep. And you can see how it kind of rolls off a little bit. So we come back forward. Trying to pin that clavicular head of Pec Major. And maybe we do one more of those. Reach back. You can go further back if you want. See if you want to bring a little extra pull into that. Nice. And you could take a nice big breath there. You can hold the arm in that position. Nice big breath into the chest. And as you exhale, bring the hand back down to your ribs. And then we soothe. Oh, that's good. So, you know, trigger point work, it takes time. It takes time for the muscles to release. We're training the nervous system, and we're teaching it by putting that input in there, you know, let go right here. Okay. So we'll just review now the other side. Getting those Pec points, Pec Major points on the other side. And again, having the client's hand up on their belly and the elbow out softens the pecs. It brings just enough little bit of rotation in there that the pecs get a little softer and they're easier to grab and work with. So I always have my clients elbow bent, hand down on the belly or on the lower ribs. And now I have the ability to give those pecs a nice pull. And then I'm going to check those outer edges, and we can find that now I want to make sure as I'm gliding over here, now I'm just in skin. So I need to make sure that I slide those fingers underneath so that I'm actually trapping that edge. Now these edge ones, sometimes the person's tissue is so sticky that it's hard to slide your fingers under, in which case you can come to standing on the side and just kind of work in, trapping those tissues against the ribs. It's not ideal. I find they release much better and it feels better to the client if I can grab them. So I'm just going to find those two spots. And I'm making sure here's the edge of the pec right there. I can feel I'm rolling off of it. And right there at that edge, I'm going to use that other hand to help push the pecs in between my thumb and my finger. And I'm going to slowly start pinching in. And now I check in with my client. Is that a tender spot there?
Yes.
And does that feel like the right amount of pressure? Would you like more or less?
A little bit more.
A little bit more. So I'm going to give her a little bit more squeeze. How about there?
Nice.
Great. And then we're going to let her breathe. Beautiful. And then if you could let me know when that starts easing up a bit.
Already easing.
Mm-hmm. So a reminder, you can play with holding the tissue between 7 and 10 seconds up to about 1.5 minutes. I don't usually hold anywhere over 1.5 minutes or 2 minutes. At that point, if it hasn't released, it's not going to in this time, right? So now we're going to kind of glide off that spot, come up here on that outer edge. Gets real thin and real fiery. So I want to hook into that. I want to feel where I can maybe feel some thickness. See if I can hook that right there. And I feel like I want to go up a little bit higher. Let's see, how's that feel? Does that feel like a good spot for me to hang out on?
Spot,
okay,
yeah.
great. And then we wait Right? And we can offer to the client if she feels like it would be helpful to do that movement, then she can bring her arm out to the side and do movement. And just get that 90 degrees right there. Yep. And wave it forward and back. Nice. And bring that other hand into just kind of support, holding that spot. Back and forward. Nice. Back. And we'll let her go one more time. Open it back. Is it feeling? It's starting to feel better. Getting a little easier. Nice. And there you go. Bringing the hand back. Wonderful. And if you want, you could tuck back under. Stay cozy. And then notice what she did. Stay right there, Tifa, don't move. Notice that when she put her hand under, see how she pushed the shoulder down? Nearly everyone does that. And that actually makes it a little bit harder to work in the pecs, and especially when you're working up here in the neck and the teres. So I always have them put the hand on the belly. Yep, and then I grab the elbows and kind of scoot that up a little bit. And that's going to really help when you're working neck and shoulders, and even in these pecs, just brings that little bit of softness. So we do a little soothing again. And so then we also have, the 3 trigger points that line up sort of along the line of the sternum. So we're going to check those out. You can do this sitting or standing, whatever works best for your body. What we also notice is that here at that sternoclavicular joint, right here, pretty much everyone has a little tender spot. Do you have a little tender spot there? Both sides, yeah? So I like to just kind of put my fingers there and just do a little rub because pretty much every single human I've ever had on my table is just a little tender spot right there. So we just get right up as close to that sternoclavicular joint as we can, and you'll feel right where the rib starts to come up and everything attaches there just as you start to slide off that, right in that little spot. It's a nice area to give a little bit of attention. And then we slide out along the clavicles. And then now we come out about 1/3 to halfway along the clavicle. Right under here is our friend subclavius. Okay. And then from that spot on subclavius, if I go straight down toward the feet, traveling distal, I find a little thickness right there. And I want to get my pressure 90 degrees, so I just make sure that I'm angling 90 degrees. And I want to know, Tifa, is there a little tender spot right there?
There is.
There is, yeah. And so breathing, just a couple of breaths. So I went about 1/2 to 1/3 of the way. And then I went straight down along those ribs. Is that feeling any better? Any easier?
Yeah, released.
Release, great. So there are 3 points along this line. The next one is down a little and medial, and then the next one will be down a little and lateral again. So I slide down, and that's a very technical way, right? Down a little and in a little, but it's just kind of the way it is. So I take a flat thumb to palpate along that area. And then we just check and see, it feels like it's more out here. Is that correct?
I feel that.
Feel that one, yeah. So we came down and a little lateral. And I can do this work sitting because I don't need my full body weight trapping this thin little pec major against her ribs. We don't want to crack her ribs, and we don't want to put so much pressure that there's a lot of pain or that her body's trying to protect. It'll grip to try to protect if there's a little too much pressure on that rib cage. Does that feel like that's freed up?
Not yet.
Not yet. Okay, great. We'll just kind of hang out there for a little bit longer. And we'll wait about 20 more seconds, see if this spot is going to want to release. And if it does, great. And if it doesn't, that's okay. We'll just move on.
There, it released.
There it goes. That's such a good feeling, isn't it? Okay. And so we had our first spot and our second spot, and now we're going to come in medially. It should be straight down from that first spot. So there's these 3 points make a little bit of a triangle. So I am going to stand up a little just so that I can shift my body a tiny bit. And I'm just kind of with a flat thumb going over. It gets a little tricky sometimes through here because you have the ribs, and it can be a little hard to discern. So if I find that if I line it up kind of right down the line from where that first spot was, and I just strum down, I can usually find a little something to hook into. And how about here? Does it feel a little tender there? Mm-hmm. Yeah. Does that pressure feel right, or do you want more or less?
It feels right.
Okay, great. What makes it easier to find just the right pressure is when you're first doing this work, ask yourself, am I pushing? Because if you're pushing, it's probably too much pressure. And it feels really different to your client when you push than when you sink into their body. When you're sinking into their body, the tissue tells you when to stop. When it starts pushing back, that's when you stop. That's when you know it's the right amount of pressure. And how about that spot? Is that spot feeling better now? Great. And then we just do some nice soothing. And then just for fun, I'm going to ask Tifa to move this arm around because she came in here with a little funky shoulder this morning. And so I'm going to ask her to move her arm through some range of motion, reach it up overhead, and then do that little bit of reaching toward back and see, does that feel, it's hard with on the table, right?
I can still feel somewhere in this section a bit of tightness, kind of constricted.
Right, and that's where those lats into where everything kind of attaches into. Yeah. Okay. So step by step. And then just to review how to find those 3 spots on the left side. On the other side, do you want to tuck that arm in so you're cozy? So on this left side, we did the squeeze and release those points. We're going to go into that valley here, and then we're going to do those. I'm going to remind you where to find those 3 points. We come out a little bit along that clavicle, head straight down, right? And there's one spot right there, so it's just almost always just right there. And then we come down and we go a little lateral, and there's often another spot right there. And then if we go straight down from that other spot, from that first spot, then we usually find, it's a little sticky right there, isn't it? Yeah, I'm gonna hold that for her. And remember, you know, you can be doing this pressure with this one hand and then doing a little soothing with the other, the mother hand, right? This is like the tough love hand, the one that's doing the work. And then the other hand is supporting the work. It's either supporting you as the therapist being able to grab that tissue by helping you to draw the tissue in, or it's helping your client, by, you know, soothing. Sometimes it's a little bit of a distraction. You know, the pecs, because they're thin, you can just kind of glide around, and wherever you feel the tissue is a little bit sticky or chunky. And it requires really becoming familiar with, what do those ribs feel like? What does it feel like along the ribs? And where are those pecs getting stuck? And so you can trace the ribs with your fingers. And we can find that first point in the triangle. Feels like here to me. Mm-hmm. Yeah. Mm-hmm. And then we do our soothing with the other hand. We might even, sometimes I'll do a little grab of the traps. I don't recommend that you use elbows in the pecs. You really can crack a rib. I don't recommend that you push with all your weight. I don't recommend that you push at all. It's more about just kind of sinking your body weight. Great. And soothing. Soothing. And we're going to drop right into this little valley right here. I'm going to stand up for this one. I'm going to sink my fingers right into that crease right there, and then I can hook my thumb in. I'm going to go right into kind of the center of that crease between the collarbone and the armpit, and I'm going to sink down until I trap that right up to the rib. How's that feel right there? Good spot, right? Mm-hmm. And we'll just take maybe 3 or 4 long, deep breaths. I find for a lot of students the hardest part about trigger point work is patience. How's that feeling? Tifa, is that feeling better? It feels so good to have that spot press, doesn't it? Don't stop. I know. I find a lot of folks don't work the pecs. And really, if you want to be successful in doing work on the neck, doing work on the shoulders, any shoulder work begins in the belly and the pecs. Oh, that feels good. You gotta do the really good feeling stuff, right? Because trigger point work is, I mean, it feels good because it's so relieving. It's right where the tension lives. But it's also just kind of slow and intense. And this work serves the trigger point release, right? Because you're soothing the nervous system, you're hydrating the tissue, you're flushing everything out and through. So it's really important to do that, work that way. Bringing in that movement and that flushing. Ah, all right. When we're going to work now in the pectoralis minor, and there's a couple different ways that we can work with it. The main spot is right up here at the intersection of the clavicle and the head of the humerus, right? We just want to kind of get right in there. We're going to sink straight down. So that's one way. And I'm going to show you another way where we actually lift up pec major, slide our fingertips under, and work deep to pec major kind of through, and we can kind of peel the pec major and pec minor away from each other. So I'm going to start right up at the top. We're going to do a little bit of soothing, just kind of let the area know that we're coming. We've already done our pec major work, so the tissue is already pretty well warmed and ready. Reminder that pec minor can be very exciting, and when you access this area, you're accessing it right near where it attaches into the coracoid process, and it can be a little nervy. So what I tell my clients often is that this point kind of, it's like I'm sinking down, there's nothing, 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 bingo, it's kind of right there. And so I'm just going to move, I want to sink very, very slowly. It's also fairly deep in there, so it's good to finagle your body around so that you can use a supported thumb. And lots of folks will use even a tool in this area, like a Bodo or a little T-bar or something like that. I just like to use my thumbs. So, but the tricky part is that you have the clavicle right there, and you need to kind of work around that clavicle with your fingers. So we follow that clavicle right to that intersection here. I can feel the front part of the humerus, the knobby front part of the humerus, and right in that little valley, that's where I'm going to sink. And now I need to angle my pressure just slightly diagonal. I want to trap down to the bone, to the rib. And then, Tifa, how you doing?
Good.
Getting anything yet?
Yeah. I feel this like fan of a muscle. It feels like a fanned shape. It's broad.
Feels like a broad fan shape. Okay. And I'm going to see if I can get my thumb. And then I'm going to move down just a little tiny bit toward her feet so that I'm up on the rib a little more. There. Okay. If I'm just sinking down into that tunnel and my thumb's disappearing and she's not really having anything yet, it means I've missed my opportunity to pin that tissue against the rib. So now I'm pinning it against the rib. And some folks will feel it referring into the shoulder, sometimes down the arm and down into the hand, because the brachial plexus travels deep to this muscle.
I can feel it in my wrist.
You feel it in your wrist.
And the inside of my left wrist.
Now we can again bring the arm out, and just that same movement as we did with pec major, but the pec minor version is going to be so much smaller, because as soon as she starts to open that back, it's going to get real exciting, yeah? And then so they can she's just waving her arm, that same movement as she did.
Oh, super fiery.
Gets real fiery, right? Yeah, because that nerve bundle passes deep to it. And it's okay, you're not going to do any damage. And then we just let her do that for a little while until it feels less fiery, less exquisite.
Starting to release.
And what you'll notice is that the client's movement gets bigger. Then you know that the tissue's opening. That's so much better, yeah?
Yeah.
So much better. Great. And so then I'm going to let her pull it back in a stretch. Yeah. And now I'm going to hold her arm and I'm just going to slide down. Nice firm pressure through that edge of pecs. So good. Now, I'm going to show you how I get into Pec Minor from the side. So here, I go right to that deodorant line. So I'll refer a lot to the center of the armpit as the deodorant line. And I slide my fingers in until I hit ribs. And then I drop my wrist to point my fingers up. And you can see how I start scooping those pecs up off of her ribs. And so now I'm going to just slide along there until I just can't really slide them in very much anymore. And then I shift the pressure by lifting my wrist. And now I'm going to actually come to stand. And I'm going to separate my feet a little nice and wide so that I can keep track of take good care of my back. I'm going to slide. And what I can feel is the kind of thickness of Pec Minor right there. How's that feel, Tifa? Is that okay? And some folks, you won't be able to do this because it's so tight. The pecs are so adhered to their rib cage, you can't get in it. And so now I just keep kind of lifting my wrist to point my fingertips down, and she's going to let me know when it's enough pressure.
Yeah, that's about right.
Right about there, yeah. So I'm lower down on that Pec Minor than I was up at the attachment spot.
It's a different sensation. It's like a bit more of a pinching kind of.
And that's because it's a bit pinchy, and that's because we're dragging some of that Pec Major with us. So again, you can't do this on every single person, but when you can, it can be really helpful if you can get into it. Great. Nice. Nice. And as she exhales, I'm just going to slide out. And give a little stretch to those pecs. Nice. Do a little soothing. Trigger point work without soothing is just torture. It just is. You just want to smooth everything out. Great. Oh, so good. Okay, now we're going to switch to the other side. And we can see that right shoulder is pretty well rotated forward. We've already done some release in Pec Major, but now the work that we do in Pec Minor and then perhaps subscapularis is really going to help us with that Pec Minor, with that rotation. Stop this one. Okay. So step 1, Pec Minor. Where that Pec Minor attaches to the coracoid process, it goes deep under the clavicle, through, and attaches to that little process on the scapula. So that Pec Minor attaches onto the shoulder blade. And so it pulls the shoulder blade forward and then attaches in a few little strips of muscle down along the ribs. And then Pec Major lays right on top of it. So we're going to get into our spot right here, into that corner where we can, the intersection of the clavicle and the humerus, the arm bone. And we get right. And then we angle very slightly toward the feet, mostly down toward the floor, very slightly toward the feet. so that we can trap it against the ribs. How's that going, Tifa? Anything interesting right there? Not quite.
I feel like the movement would be toward the outside, maybe?
Mm-hmm. And so once you get deep down in, I mean, I'm deep. There it is. You can just shift your angle a little bit until your client does what she just did. There, that's it. Right? And I'm standing up over, my arm is straight, and I'm sinking down. Does that pressure feel right?
Mm-hmm.
Okay, great. And then, Tifa, would you like to take that arm out and do a little bit of that rotation? Yeah, just taking it out, right? Makes it really exciting. Yep.
Starting to soften.
Great. Are you feeling this one anywhere else besides where I'm pressing?
No.
Okay. Mm-hmm. Okay, that feels good. Yeah. Whew. Mm-hmm. And then we're going to see if we can get this spot. So I go right for that deodorant line, slide my fingers in. They can rest their arm right on yours. Drop the wrist, slide up, and then lift the wrist. And you're pointing, you're aiming kind of toward that clavicle. And then as you start to lift the wrist, the fingertips press down into that tissue of maybe Pec Minor. Hopefully you got far enough that you can activate or reach the Pec Minor. It feels like right here if I hang out there. Mm-hmm. I'm just going to let her take a few breaths. It feels like it's softening a little bit right there when you did that. Yep. And then I'm just going to slide my fingers out. And then I like to bring them into that little open, reach the arm back a little bit, stretch that Pec Minor out, do a nice deep soothing stroke. All right, we're gonna tuck that under. Ah, great. How's that feeling? Okay?
Mm-hmm.
Great. Wonderful. When we're going to release Latissimus and Teres Major, I always release them together because they live right next to each other, as we saw in the anatomy section. So I also like to just widen my clients' elbows away from the sides of their bodies so that gives me space. So as space to do my work. So here's that back flap of the armpit. That is Latissimus and Teres Major, and up in the top, Teres Minor, where it gets all thick in there. Here's the bottom corner, that inferior angle of the scapula on both sides. And we can grab that lats and teres right there. So we want to do some nice soothing. And I like to do some soothing across the body. These points can, like all trigger points, you know, be really tender. So we want to just let the body know that we're coming, we're getting ready. And remember that lats go all the way down to thoracolumbar fascia and the low back. So doing some nice work through there, just gliding up the side. You can glide down the erectors, and glide up the side. Then I'm going to come to the same side of the body. In Latissimus, Teres, now on the same side of the body. I'll glide my hand down along those ribs. When you're gliding up the ribs, let your hands be kind of flat. If you that pokiness doesn't always feel so good, and it can just be a little aggravating. So try to keep your hands nice and flat and using broader parts of your hand. All right. So now that we've done some of that warming up, we're going to grab into the lats and teres. So the latissimus point that we're working with, we really need to grab this back flap. You can see that lats goes all the way down to here. So again, we slide the fingers into the deodorant line. And this time now we're grabbing the back of the armpit. And I'm not squeezing very hard. I just want to see that my fingers are under that tissue and can move it. And then my thumb locates the inferior angle of the scapula. And as my thumb locates that, now my fingers underneath can kind of try to meet toward that thumb. And then I slide off that angle and start to slide outward. Now, just like in the trapezius, the lats point is right before you slide off. Oop, there, see, I just slid off. Now I'm in skin. Boop, right there. You don't want to do that too often, but I'm just wanting to show you. That's how we find it. We get right to that edge, and usually right around that area where the that inferior angle is, we can grip those lats, start sliding a little bit up and down. And then I just keep kind of squeezing around like, oh, and then I land. And then I want to squeeze a little firmer, and then I want to check with my client. Is that a tender spot there? Feels good. So I'm right at the edge of the muscle. Then there's skin. Then there's skin. So it looks like I'm kind of far in, but I'm really not. I'm literally on the very edge of the muscle. And if I pull out wide, I'll slide back off. And actually I'm going to just, sometimes I give a little wiggle. Sometimes that trapezius, that latissimus point, excuse me, you can feel it really twitch and release. So now I'm going to come up a little further up, because I feel that's just kind of calling to me. Feels a little thick there. How about there? Tifa, does that feel like a good spot or no?
It does. A little more pressure.
A little more pressure. So I gave her a little more squeeze. And when someone asks you for more pressure and you're putting more pressure, and it's not really giving them what they want. It just means that it's not probably a focal point of tension. Maybe you need to move slightly or try something else. Often it's shifting your angle a little bit. And just doing a little soothing while you're waiting for the latissimus to ease up. Yeah, great. So now as we come up, so Teres Major begins right here on that inferior angle. And then it goes and follows along, it joins with the latissimus. So as I come up further, higher up in that armpit, I can start to strum and feel. I call Teres Major the fat sausage of the armpit because it does feel a bit like it's thicker, it's meatier than the thin latissimus there, and I can follow it all the way down to that inferior angle. And I find that if I walk up it, just kind of strumming it with my thumb, I can just start to feel where this point is often kind of a mother lode point. I'm about halfway up along the lateral border of the scapula, and I'm just off where I can feel in that thickness. Oh, there we go. That's our Teres Major. So we're going to squeeze that right there. How's that spot? That was her response. This really is often a very key spot. So right pecs, lats, and teres, the big three, all working together to internally rotate the shoulder, also to draw the arm down to the body. And we're just going to take one more breath here. How's that feeling? Is it releasing a bit? Yeah. Nice. And then we'll do some nice soothing. Lats and teres. So good. Now Teres Major also, and you can keep playing around. That's that main trigger point in Teres Major. You can go up a little higher. It starts getting a little harder to differentiate between Teres Major and Teres Minor up here. Teres Minor, just that little feather of the wing of infraspinatus. And it gets a little thicker. You know, Teres Major dives forward and attaches up at the anterior humerus. So I find that halfway up from the bottom and top of the scapula along that lateral border, that's where we find that major point in Teres Major. And then I always like to check a little, sometimes right at its attachment right here on the bottom, that inferior angle of the scapula, we might find another trigger point in Teres Major. So I'm just going to take my supported thumb and I'm going to feel around a little bit, and I want to angle my 90 degrees to the body, and then I'm going to sink straight into that. And how about there, Tifa? Is there anything tender right there?
Yeah, I can feel it down my arm a bit.
And she's feeling it down her arm a little bit. And just letting me know when that starts to feel a little easier. And she said it's releasing. And maybe take one nice big breath here, big in the belly. As you exhale, let your bones sink heavy to the earth. Whole body sinks toward the earth. Yeah, great. Awesome. So that is Latissimus and Teres Major on that right side. And then now we're going to do the same thing on the other side. Now we didn't really warm up this side, so I'm going to show you warming up Same side, just gliding along. Right? You want to get a little bit of oil on the whole of the back so that you have enough glide to really warm up the whole of latissimus. Now, for some folks, it will be difficult to grab those lats. Some folks, you'll be able to get your hand under around that deodorant line, right? And then kind of coming down along. You might even be able to get like 2 hands, which feels really nice. Kind of grab it and kind of peel it away from the side of the body. Not too much squeeze, because you don't want to be squeezing the trigger points necessarily while you're doing this. You're just trying to kind of pull that tissue away. And then when you're ready to hone in on the points, you find that inferior angle of the scapula. Right, there it is. Place one thumb or finger on that. Slide the working hand fingers underneath. Bring the working hand thumb to that inferior angle, and then start to draw the fingers and the thumb together, trapping the tissue in between. And you slowly start to glide outward. Oh, and I could see there was a little twitch right there, so I'm going to hang out on that little spot. Even though it's not all the way at the edge, it's close, and it gave us a little twitch. And I'm just going to kind of shift my where I'm squeezing a little bit. And then I'm going to come out wider. Oh, and there we are, right at that edge. So we're going to hook that edge. We're going to give a squeeze. And we can just bring in that mother hand, a little bit of soothing. There it goes, another twitch. Great. And then we'll start to walk up, getting into a little bit that Teres Major. Remember, it comes from this inferior angle and gliding up into Teres Major right around halfway between the inferior angle and the superolateral angle of the scapula. And come about halfway, come right off that edge. We get down into the thickness right there, that thick spot, and that intersection. How about right there, Tifa? She said. That is what most people say, something like that. Teres Major. Teres Major, external rotation at the shoulder, internal rotation of the shoulder joint. Teres Minor with infraspinatus doing that external rotation. Pecs, lats, teres, internal rotation. Infraspinatus, Teres Minor, external rotation. Yeah. And you can explore and spend some time in here. And take breaks, because those points can be real tender. And then we're going to check that Teres Major spot that sometimes gathers right here at that inferior angle around its attachment. So we flat thumb, palpate around that inferior angle. Find a little spot that maybe feels a little sticky or a little chunky. Get 90 degrees to that spot. You can stabilize that corner of the shoulder blade by just making a V with your fingers around if it's sliding, and then you can press right in. How's that spot, Tifa?
Feels like maybe outer.
Mm-hmm. And let's see if I can.
Yeah, there we go.
Mm-hmm. So she asked me to slightly toward the outside laterally, and we shifted. That's the thing about this work. Invite that feedback, because you want to be right on the right spot. And everyone's anatomy is a little different. Because of the way that tissues layer in the body, you're not always going to feel the trigger points. You just can't. And so you ask and invite that feedback so that you can get, because it's all about angle. How's that spot feeling now, Tifa? Getting released? Softening them?
Yeah.
Great. Awesome. And we'll do some soothing.